Hi, I'm Kathleen Drumheller. You know, I was only 19 years old when I had my first child. I was a scared teenager who didn't even know she could be a good mom. But there was one thing I did know for sure. I only wanted the best for my baby. And anyone, man or woman, can agree that if or when they have children, they only want the best for them. And for me, the best started at birth, with breastfeeding. Breast milk is a unique nutritional resource that cannot adequately be replaced by any formula. And the benefits of breastfeeding are numerous, and not only for the baby, but for the mother too. So today, I'd like to tell you about some important facts about breastfeeding. First, I'll tell you about the benefits to the baby, and then I'll talk about the many benefits for the mother as well. And then finally, I'll talk about the important bonding that occurs while breastfeeding. As I said, the benefits of breastfeeding for babies start at birth with the mother's colostrum, which is a pre-milk that she can start producing even before the baby's born. But this colostrum will help the baby's digestive system to grow and function properly. And then when she gets her milk supply in, this milk is much easier for the baby to digest. This means there'll be less gas, less constipation. And studies have shown that babies who are formula fed have a 3 to 4 times more likely chance to develop diarrheal disease. In addition to being easier to digest, breast milk also contains antibodies that are passed from the mother to the child. These antibodies are very important in helping the baby build up a resistance to disease and illness and help fight them off. And breastfed babies are also at a lower risk for many childhood diseases and illnesses, like ear infections, viral infections, asthma, allergies. And studies have also shown that babies who are formula fed have a 3-fold more likely chance of developing respiratory infections in the first year. And the Natural Resources Defense Council says that breastfeeding for the first 3 months can reduce the child's risk of developing juvenile insulin-dependent diabetes by 34%. And both the American Academy of Pediatrics and the Surgeon General agree that breastfeeding reduces the risk of SIDS, or sudden infant death syndrome, which is a common fear for many mothers. And the benefits of breastfeeding are seen later in life too. Adults who are breastfed, on average, have a lower blood pressure and have a lower risk for heart disease and obesity. But as I said before, the benefits of breastfeeding are not only seen by the child, they can also be seen by mother too. The mother grows both physically and emotionally from the relationship she develops with her baby while breastfeeding. And just as breast milk is specifically designed to nourish her baby, the production of breast milk also aids in the mother's health. The American Congress of Obstetricians and Gynecologists says that breastfeeding stimulates the production of the hormone oxytocin, which stimulates the uterus to contract, bringing it back to normal size faster. And it can also reduce bleeding that occurs after delivery. Breastfeeding also burns calories, lots of them, up to 100 calories per hour. This can help mom lose those extra pregnancy pounds and return to her pre-pregnancy size much faster. And studies have also indicated that breastfeeding can reduce mom's risk for certain cancers. This includes ovarian cancer and breast cancer. And it can also reduce her risk of developing osteoporosis later in life. Finally, breastfeeding is very economical. In the first year, mom and dad can save up to $800 by breastfeeding that they would otherwise have to spend on purchasing bottles, formula, and other supplies. In addition, because their child is more protected from diseases and illnesses, they can save thousands of dollars on medical care costs. But one of the most important benefits of breastfeeding is seen by both mother and baby, and that's the bonding that occurs at this time. Excuse me. Research shows that the bond between a nursing mother and her child is stronger than any other human contact. And the relationship between the mother and baby is rooted in the interactions that occur during breastfeeding. Even moms who choose to formula feed are told by their doctors to hold their babies close to their breasts to try and mimic the actions of breastfeeding. Breastfeeding provides both warmth and comfort for mother and baby. So as you can see, there are a wealth of benefits that can be had by breastfeeding for both mother and baby. But this is not to say that breastfeeding can't be hard. It can be, but there is a lot of support out there for willing mothers. It starts at the hospital. When you go in for delivery, tell your doctor you plan to breastfeed. They can provide you with a lactating consultant who can be very helpful. I know I had one, and she was wonderful. She showed me different techniques and gave me lots of advice that I could use at the hospital and then take home with me. And then when you do get home, there are other organizations that are willing to help you, like WIC, or Women, Infants, and Children, who not only have breastfeeding support groups, but they also have a breastfeeding hotline that can answer almost any of your questions, and they are willing to assist you in any way that they can. And they also have a wealth of resources to share with any willing mothers. So for anyone out there who's considering having a child now or in the future, please remember, the breast is best. So give your child a chance at the best. Thank you.